as our panelists for today, and we're going to be discussing traveling with diabetes. And Dr. Hundal, I will move to your first slide.
All right. Okay. All right. So being an endocrinologist, I frequently, my patients ask me, okay, I'm traveling to this and this place and what I need to do. So we thought of having a talk regarding this important topic. Even people with diabetes, they don't need to stop their lives. They need to enjoy their life, go around, enjoy as any other person, non-diabetic person does, but just with some take other precautions and they have to be careful about the medication, other things. So that's was the purpose of the talk today, is to how to prepare for a travel plan and how to do the best and avoid any major problems which can sort of create havoc on your travel things. So again, safety comes first. So again, in general, we have highlighted some of these important points. I will elaborate on some of them where needed. So again, in general, don't wait until the last moment of the travel. Always plan ahead of time. Pack your medications, important things, way before, ahead of time. Don't start like few hours before or the day just before, because always when you do something in a hurry, you will mess up things. You will forget about important medications or something else. So always take precautions and say, okay, I'm going to pack 2-3 days way in advance. So always keep the phone number of your physician handy. That's very important. Wherever you are, especially in the United States, your physicians will be available. Something emergency comes, you're not sure what to do, you can always call them. That's important. And to where you are planning to go and live for a few days in a hotel or somewhere else, always look around. You can Google search a local pharmacy, especially if it's a 24-hour pharmacy, that's even helpful. For some reason, if you miss some medication, forget to take them with you, or you need at the last moment, some people say, oh, I don't have any medication left, I need to be called over here, I left this medication at home. So have a pharmacy number available, because if you call your physician, that's the first question they will ask you is, okay, which pharmacy you want me to call the medications. So that's very important. Good idea to carry the list of your medication. Some people are very good. They will remember each medication and the doses they are taking. If you are not good in remembering things, carry the list with you. If something emergency comes, you have to see someone, or even sometimes 911 is called. If you have a list of the medication ready, it will help those individuals to find out, okay, what you are taking. Sometimes people may carry a medical alert bracelet, especially if you're traveling alone and suddenly your blood sugar drops low. Then the person sitting next to you or who is attending to you may not know that you have diabetes or not. But if they see a medical alert bracelet, they will immediately realize, and sometimes low blood sugar people can pass out. So if somebody sees a medical alert bracelet, they can easily take action and then bring blood sugars up. Getting a travel letter from your physician also is helpful when you're going through the security. That will highlight that you have diabetes and you are carrying these insulin syringes, needles, other sensors with you. So that is always helpful. And very, very important thing is always pack more than what you need. Suddenly there is a flight delay, something else comes up, you get sick, then it's important to have extra medication. So that's very, very important. Always pack more than if you're going out for 1 week, maybe pack for 2 weeks. So in that way, you don't run out of the medication. All right, next slide. Now, if you are wearing your sensor, glucose sensor, or you have the insulin pump, then you can, while going through the security, you can let them know, so that in that way they can sometimes, if you don't want to go through the main machine, like where they screen you, they can just with a handheld screener, I mean, they can patch you and just make sure that your equipment doesn't get damaged. But in general, going through the security, it doesn't damage. The sensors, if placed in a deposit where the luggage which you plan to deposit, those type of x-rays can sometimes damage the sensors. So it's important to carry the extra glucose sensors in your carry-on bag and not in the bag which you're going to deposit. So that's important. The insulin pens, if you're carrying an ice pack, take a separate bag. You can put a ice pack over there that will keep the pens. If you're traveling for a longer period of time, then good idea to keep the insulin pen. And once you reach there, then you can put it back in the refrigerator. If you're driving, inside of the car sometimes gets very hot. So especially if you stop in between and then go out for walking or something, by the time you come back, the car will get very hot. So don't leave insulin or other equipment like that. Always keep it with the cooler, especially when you're driving. You also will like to pack healthy foods and then plenty of water to drink. Don't, as I mentioned, don't leave these insulin pumps, insulins like outside in hot weather. So because that can also damage the insulin and other equipment. And when traveling, always carry extra snacks with you, glucose tablets with you, and especially if you're carrying glucagon injections, they're very helpful, because suddenly if you don't eat, you have taken your medication, blood sugar goes very low, you will require your glucagon injection. So these are important things to remember, to pack them along with your medication supply. Keeping your medication in original packaging, if possible, that's good. But again, if there are too many bottles, then you can take it out. There is only one diabetic medication called Rybelsus that should not be taken out of the original bottle, because it's can easily, if you leave it outside or in a different container, the moisture can build up in that and it can sort of make the medication ineffective. So always important to keep it in original packaging for this medication. Now, for going to the security, the people with diabetes, they are exempt from the TSA rule of not carrying more than 3 ounces of liquid. So if you have that travel letter, they will let you go through that. You can say, okay, I'm carrying this, my orange juice with me, where I tend to have low blood sugar, so I need to keep it with me. They will allow you, but you need to have that letter with you. There's an optional TSA disability notification card that you can print and carry with you. That will also help you to quickly move through the lines. And then always carry fast acting carbs like glucose tablets, hard candies, whatever you like and normally use it, keep it with you. That's important while in the flight, or later on if you need it, you can quickly eat those things and avoid low blood sugars. And then always eat healthy food during your travel. So here is a list of medication, and Caroline is going to talk more about the dietary choices that you should have while traveling. So because you don't want your blood sugars go too high or too low during travel, that also messes up your whole day. So if it's running too high, what you will do is frequently you have to go to the bathroom, and that also is not good while on the flight. So again, you want to have a reasonable control, but always eating healthy food is important. Next one. So during travel, please make sure keep well hydrated. That's very important. There are certain medications like Jardiance, Farxiga, Metformin. With those medications, it's important to drink plenty amount of water. You don't want risk getting dehydrated, and that can affect the kidney function test, and it can affect with these medication can cause volume depletion. People can feel dizzy, blood pressure can run low. So again, important to make sure you drink plenty amount of water. Carry water with you, or if you don't, then in between, no harm in asking the flight attendants to give you water. Avoid too much of caffeinated drinks, which can cause more dehydration. So drink more water. During flight travel, or if you're driving, don't keep sitting for too long, risk for blood clots. So every hour or so, just get up, walk around, and then you can get back to your seat. Then also plan according how long is the flight, and when you will be able to eat or not, because if you take your usual medication, especially if somebody's on long-acting insulin and other drugs like called sulfonylurea, these are glipizide, glimepiride type of drugs, or glyburide, these are long-acting medications which can cause low blood sugars. So for example, if you take these medications in the morning and then while doing the flight, there is nothing to eat, you miss your meals, you were running late, you did not pick up your lunch, and nowadays in the flight also, they don't give you proper full meal tray. There are some snacks that you can buy. So, but again, if you miss your meal, then if you have already taken the full dose of insulin and other medication, then risk for low blood sugar. So again, be careful. If you're not sure, maybe take half the dose. Keep a watch on your blood sugars. I mean, you don't want either too low or too high. So average 120s, 150s range, that's a good number to shoot for. Then, as I explained earlier, keep your glucose tablets, snacks handy. So immediately if you feel some low blood sugar reaction while sitting in a plane or driving, immediately take some glucose tablets. Obviously, if you're driving, then immediately stop driving. If you are the driver, make sure you check your blood sugars, that it's not running low, because driving with the low blood sugars can really jeopardize your health and someone else on the road. People can be in accidents. So important to make sure your blood sugar is staying above 100. Then keep your glucose meter, the test strips, lancets close by, handy, because you want to, while traveling, you want to make sure if you have in somewhere else, it's not handy, then you will where to find the lancet. So where is this? Where is that? I need check my blood sugars. So always keep it handy, which is easy for you to check if the blood sugar is on the low side. Next slide. Sometimes if you are hiking, going to the higher altitude, that can lead to incorrect blood sugar readings. So just be careful. For every 1,000 feet of height, there may be 1 to 2% lower blood sugar readings because of the lower oxygen pressure. So just keep that in mind. And also when flying, just avoid injecting air into the bottle sometimes, because the pressure that can cause more pressure buildup. So just have to be careful about these things. But most of the time, the pressure within the air flight is reasonable and you should not have a problem.
So today we're going to kind of go through ways we can eat out, be mindful while we do so, but also still enjoy the fact that we're vacationing, that we're enjoying other parts of the country or other places that we've never been before. So there are ways we can manage our blood sugar. Our goal is just to prepare ourselves with the knowledge that supports our blood sugar and gives us sustainable energy, right? If you've got a long day ahead, obviously going with really simple carbohydrates like a bagel in the morning, right? That's not going to sustain you for a long time, and your blood sugar is most likely going to hop up pretty high. So we could work with certain types of carbs, pair them with certain things like proteins and fiber, and that's going to help keep that sustainable energy and keep you going for a longer time than something as a simple carb would just kind of fizzle out after a couple hours. So some eating out tips just to get us started. We want to get creative. So a lot of restaurants these days, you can look ahead, you can look online. They have their menus online, which is fantastic for kind of preparing yourself before you go in. I know when I'm hungry, I can't really think straight, so I'm going to pick whatever sounds good. But if I go into a restaurant with some ideas that I know what's on the menu, right, I have less of a chance of kind of picking something out of just straight feelings of hunger and more of, oh, that sounds good. That's going to support my blood sugar a little better. This might sustain me a little longer. So giving yourself that time to kind of look ahead, see if they have a menu online. A lot of places actually have the healthy choice options, which is great because they have, I think they're marked with like usually like a little symbol that says these are normally like a lower calorie or a lower carbohydrate or higher vegetables. They're also usually pretty better in portion size too. So those are a really great place to start looking when you are going somewhere new or going to a restaurant.
So we're pretty much we're going to discuss about managing diabetes during sick days, which will include how to prepare for it, and then eventually we're going to talk about some of the indications for going to the hospital. So, with diabetes, it can be particularly difficult to control the sugar, basically because of two reasons. One is when you're sick, sometimes you have decreased oral intake, and it can potentially cause hypoglycemia. On the other hand, illnesses such as colds or flu can actually increase your stress hormones, and in turn can increase your blood glucose levels. So what exactly is hypoglycemia? So I think we had a separate webinar, I believe a couple of years ago, but it's what is it exactly? So hypoglycemia is a condition when the blood sugar level becomes dangerously low, usually when the sugar is less than 70 milligrams per deciliter. And some of the symptoms include sweating, shaking, chills, being lightheadedness, weakness, sometimes palpitations, blurry vision. In some patients, they may complain of feeling of tingling sensation of the lips, tongue, and the cheeks. On the other end of the spectrum, when your sugar is high, you can develop a condition called diabetic ketoacidosis, or DKA. So this usually occurs when the body becomes or they don't have enough insulin to cope up with the high glucose levels. So they end up breaking up some other sources of sugar, which includes fats. And one of the byproducts of these breakdown is ketones, which can be detrimental for your body. Some of the signs and symptoms of DKA may include high glucose levels, as I've mentioned, high ketones, increased thirst, dry mouth, frequent urination, nausea, vomiting, drowsiness, and some patients may complain of having a fruity odor or of breath. Most of these patients, they end up getting admitted in the hospital because they can be very fatal. In some cases, it can lead to death if you're not able to cope up with the demands of the disease. So most of the time, they get admitted in a step down unit, which is like a one level down below ICU. So management of diabetes, I think usually starts with preparing for it. I think Caroline will touch base with how to come up with the sick day kit, but essentially have to make sure you have enough diabetes medications, enough food. That's a very easy source of carbohydrates, and this may include sports drinks, canned soup, gelatin crackers, instant pudding. And then obviously you have to make sure you have the glucometer to monitor your blood glucose levels. And some patients may also use a ketone meter, especially if they're having some of the signs and symptoms of DKA. You can use a ketone meter to check your ketone levels. So how to manage sick days? So essentially, fluids is a big thing. So you have to drink lots of fluids, about 4 to 6 ounces every 30 minutes. For those patients who are not able to keep anything down, a few sips every 15 minutes would suffice as well. And aside from fluids, you also have to keep up with the carbohydrates, especially if you're not able to keep anything down. Also important to note that we usually recommend patients to take in their regular diabetes medications unless otherwise directed by their physician. So there might be some patients who we have to adjust some of the medications it's really a case-to-case basis, but for most part, we usually recommend them to take their medications, their regular medications consistently. And then obviously you have to keep an eye on your sugar at least every 2 to 4 hours. For those patients with hypoglycemic symptoms, there is a 15-15 rule, which I think we may have discussed previously. So essentially what this means is if you have signs and symptoms of hypoglycemia, you can take in 15 grams of carbs, and then you have to wait for 15 minutes, check your sugar levels again. If they're still low, then you have to repeat the whole process again until you get your sugar above 70 milligrams per deciliter. So again, the part of the managing sick days would be, again, keeping an eye on the ketone levels, temperature, because sometimes when you have persistent fever, there might be something going on. So we have to keep an eye on that one. Checking weight daily is also important because, you know, when you're losing weight, that means you're not absorbing sugar. And this is a good acronym to remember. So SIC, so S for sugar. Again, I mentioned earlier, checking your sugar every couple of hours. I for insulin. So if you're somebody who's taking insulin, we usually recommend them to take in their at least their basal insulin. Carbs, C for carbs, and then you have to make sure you drink lots of fluids and carbs. And again, like I mentioned earlier, the ketones. If you're having symptoms of DKA or the diabetic ketoacidosis, you can use a ketone meter to check your ketones as well. So in some cases, if patients are really sick, they may need to go to the hospital. Some of the possible indications for going to the hospital would include the following. So difficulty breathing, you know, ketone levels, if they're significantly high, coupled with some of the other symptoms, then you definitely have to consider going to the ER. And then intractable vomiting, or for those patients who are unable to keep anything down, especially if it's been going on for about 24 hours, then we usually recommend them to go to the hospital, at least to get some fluids. And then obviously, if your sugar is persistently low, like less than 60 milligrams per deciliter, then we sometimes advise patients to go to the ER. Persistent vomiting, like I mentioned, and then severe diarrhea, especially for a long period of time, more than 6 hours, can increase your risk of having dehydration. So for these types of symptoms, we do recommend patients to go to the ER. And then again, increased sleepiness and then persistent fever, you may want to consider sending the patients to the hospital. And I think Caroline will touch base, or will actually discuss about what to put in the sick day kit.
Awesome. Thank you. So we never know when we're going to get sick, and we want to be prepared for it because it could hit anytime. Sometimes we can prepare for it if people around us have been sick, but it's good to have things on hand. So we're going to talk about how to create our sick kit, what to put in it, and even some kind of nutrient values to pay attention to with certain types of sickness. So our sick day kit, you kind of want to have either a basket or a box that you can put really shelf-stable things in. So like a soda, we like regular soda and a diet soda, or diet juice, regular juice, just because you want something to help treat that hypoglycemia. You want something to bring up your sugar pretty quickly, but you also want something to drink throughout the day, because sometimes you really want to keep your sugar in a stable level. So we want both sugar-filled beverages and your regular non-sugar-filled beverages too. Also some things like some Jell-O, soup that's ready to go, crackers, applesauce, things that really settle in the stomach well, but can be stored for a pretty decent amount of time. In this picture, you'll also see that there's like a glucerna. So that is great to have, like a protein shake that's shelf stable. So if you really can't either get up and prepare something, you just can't hold things down, it's really nice to be able to have that quick nutrients for you. So you can keep that on hand as well. But you also, Dr. Valencia mentioned keeping medical supplies. So having some diabetes medication, even like a week's worth, stored up in your sick kit, ready to go. having glucose tabs or gel, even having over-the-counter medicine, because sometimes when you're sick, you just need it really fast. So keeping that in mind when you're building your sick kit. We'll talk a little bit about kind of guidelines. So on the next slide, there is some guidelines on, oh, could you go back one more slide? Sorry. Perfect. So drinking plenty of fluids, Dr. Valencia mentioned kind of how much to drink, how often. We want to keep going for having clear liquids kind of flushing through your system at all times to stay well hydrated, because your nutrient needs really go up when you're sick. Small portions, especially of the sugar-filled beverages. So we want to make sure, even if you are drinking a regular soda, if you can't get in regular food to get your sugars up, that you do it in small amounts, like 4 ounces at a time at most, just because we don't want you to have a hyperglycemic episode where your blood sugar is shooting up. So if you can't eat meals, sticking to things that are really easily digested, like unsweetened applesauce, half a cup of fruit juice. Basically, we just want to try to keep your sugars as stable as possible. Small sips of clear fluids, sports drinks, teas, and broths if you're vomiting. And 1 to 2 tablespoons every 30 minutes, kind of going with the flow as much as you can tolerate, but not too much, staying away from the fizzy stuff. And as always, you could always contact your healthcare provider, your dietitian, if you really need extra guidance on what specific foods to eat during that time. But even so there's specific, all different kinds of sicknesses, but especially with COVID-19, there are specific nutrition guidelines for COVID-19. So especially because it affects everyone differently, we want to make sure that you're meeting those needs just so we can kind of speed up the recovery process. So for fluids, it's actually about 3 liters of fluid is recommended per day. There's been some really good research out there that good fluid and nutrition during COVID-19 recovery actually speeds up your recovery. So 3 liters of fluid per day, that could be clear, that could be, you're drinking a protein shake that still adds to that fluid intake. About 2,000 to 2,500 calories, depending on the patient. Especially with a fever. When you have a fever, your nutrition needs are elevated because you're trying to fight off something. So you want to make sure that you're getting a good nutrient-packed diet if you can. And then protein as well. It's usually a little elevated at 75 to 100 grams per day. So picking protein-filled drinks, protein-filled snacks. Really, if you're not feeling hungry during the day, those small frequent snacks are going to be really great for meeting your nutrition needs when you don't feel intake a lot. Maybe like 6 small snacks a day, 2 to 3 hours, having something, even just nibbling on something if you're not feeling hungry enough for that. So eat small amounts frequently, keeping an eye on the timing of things, and just prioritize those fluids. And on the next slide, we actually have some examples of some carbohydrates. What do they look like? If we need to get 50 grams every 3 to 4 hours, if we can't keep food down or we're not hungry, what are we going to choose? So these are just some examples of 15 gram carbohydrate choices. So for every 3 to 4 hours, maybe doing some combinations of these easily settable ones in your stomach. So saltines for 15 grams, maybe add a Jell-O for 15 grams. And then you could even add some Gatorade on top of that. About a cup of that would be 15 grams. So you're close to that 45, 50 range. So we have a couple choices if you're getting that 50 gram every 3 to 4 hours to maintain your blood sugar. Vice versa, if you're doing 15 grams for that 15-15 rule, if your blood sugar is really low, these are some really quick grab, simple carbohydrates, because we want something super easily digestible, very quickly digestible, so your blood sugar comes up. But we want to make sure we don't go over 15 grams. If we go, 45 grams when we have a low blood sugar, that could cause a blood sugar spike. So we don't want you to go from low to high really fast, because that's pretty stressful on your body as well.
So tonight, I want to focus more on the exercise side, and we'll touch on nutrition at the end of the presentation. But first, I will just list some of the things that exercise helps us with. And some of those include blood sugar regulation, which is really important when you have diabetes, just because anything that we can use in our daily practice to help manage that is going to improve a lot of different health markers. So moving the body helps keep blood sugar more consistent and more stable. And over time, it can also possibly decrease your need for medication. So that's another really important benefit. And with that, it tends to improve your body's sensitivity to insulin, which helps regulate blood sugar. It also will decrease risk of heart disease and other comorbidities that often come along with long-term diabetes. It will help improve mood and energy levels. It can also help improve your sleep quality, regulate your appetite. And with all of that, it can also decrease your overall stress, which helps just even be able to manage our mood and even manage how we go throughout our day if we can decrease our stress levels. And then over time, exercise can really improve your balance and even functional capacity, just whatever it is you have to accomplish throughout the day, whether it be housework or physical labor of some sort. Exercise can really help with that process too. So I'm going to go into just giving you some practical tips on what it might look like to build your own exercise routine. When we develop recommendations for exercise, they're centered around two different things. We tend to focus on cardiovascular training, which is lighter intensity on the muscle groups. We're doing repetitive motion with all of the major muscle groups at the same time, which really stresses our cardiovascular system, our heart muscle, which is extremely helpful in regulating our metabolism and our blood sugar. And it just strengthens our heart so that we can be more efficient with pumping blood and nutrients throughout the body. So we're focused on getting our heart rate up, getting our breathing rate up with cardiovascular training. And then with strength training, we're a little bit more focused in on the actual strength of the muscles working. And we found that research has shown that when you can incorporate a combination of both cardiovascular training and strength training over time, it's a lot more effective in improving your health. So generally speaking, the American College of Sports Medicine recommends that when you are doing cardiovascular training throughout a week, you try to work up to being able to do at least 150 minutes per week of moderate intensity activity, or 75 minutes per week of vigorous intensity activity. And I'll break down what that would look like in future slides. When strength training is concerned, we try to have people focus on working all the major muscle groups. So back, arms, chest, legs, especially muscles connected with our trunk, because that helps just support our back and helps with posture and balance. We try to work all of those muscle groups at least 2 days a week, but we don't want them to be consecutive days because it's really important to allow for that time of recovery for the muscles. So when you are trying to figure out where to start, one really, really important aspect to this is what is fun for you? What is enjoyable? Because we are so much more likely to repeat things that we enjoy. And I think a lot of times when we hear the word exercise, we think inside this box of going to a gym and lifting weights, or going to a gym and getting on a treadmill. And that thought doesn't elicit joy for most people. So this is where I would encourage clients to think outside the box, think about what movement brings them joy. Is it gardening? Is it playing a sport of some kind? Is it going for a walk with a friend? It could be so many different things. Maybe it's dancing, and you definitely have to take into consideration where your own mobility is at, what the starting point is, and think realistically how we can progress toward that activity if that's not where you're at right now. So some examples of ways that you can incorporate both cardiovascular training and strength training might be, maybe if you're gardening, just trying to, lifting things, or even pulling weeds sometimes might simulate more of a strength training focus in that activity. Whereas if you're walking, or even like taking a wheelbarrow around, that might be more of a cardio type activity. But the biggest thing when you're starting is trying to envision those things that would bring you a lot of joy. And some people really enjoy exercise involving just being by themselves. You know, they're by themselves out in nature even. Others are really motivated by meeting with a friend or going to a class and having that kind of structure and that accountability, that camaraderie that goes along with meeting with others. So try to figure out what motivates you most and incorporate that. As my slide mentioned, consider where you're at now. If you're in a place where mobility is limited, you haven't been active for quite some time, we want to focus maybe on starting more with a cardio emphasis in your training and not incorporating too much strength training right off the bat, just because that can cause a lot of soreness at first that might be discouraging from discourage you from wanting to continue. So we start lightly just by moving the body with cardiovascular exercise and then slowly add in some more strength training. It's really important that you talk to your doctor before starting anything too serious or structured, just to make sure that your doctor is aware of that change in activity and could recommend any changes to your medication and even diet changes to help support that. It's definitely important to surround yourself with a team, with a support system in this, especially professionals who can help you in your health journey with exercise starting to be incorporated. When you're trying to build a structured cardio program for yourself, there's something that we tend to look at. It's called the FIT principle, and it stands for F would be frequency, how often you want to try to do the exercise. I is intensity, you know, how hard you're working. T is time. And then the second T is type. So with cardio, you want to try to aim to be active, getting your heart rate up, breathing rate up at least 3 to 4 days per week. Research shows that moderate to vigorous intensity activity can make your cells a lot more sensitive to insulin for up to 48 hours. So it's helpful if you're active in some way at least every other day. And that will help control your blood sugar. I is intensity, and there's something called the talk test that is just a general way to determine about how hard you're working. And as you start to move and engage in that cardiovascular activity, pay attention to breathing rate. You expect that to come up, but you should still be able to carry on a conversation with someone. You might have to take a breath here and there, but you could continue to talk to them without it being a lot of effort or having to take a lot of breaks in between words to get that breath in. If that kind of activity would be categorized in the moderate activity category, and that would fall into that 150 minutes per week goal. Now, if you would progress past moderate to where now you're really breathing hard and it's difficult to carry on that conversation, you're probably bridging into vigorous intensity activity. And that especially is something we want to be careful about when you're starting back into exercise, and something that I would want to see you working with an exercise physiologist or have your doctor give you recommendations on that, just because it does stress the body a lot more, and it's better to stay at a lower intensity level of activity at first. But like I said, if you really kind of start to bridge into that space of having difficulty carrying on a conversation, you're probably more in the vigorous activity category. And I would just encourage you to slow back the intensity down at that point. Now, as far as time goes, if we take the 150-minute recommendation and broke that out over 3 to 5 days, that's kind of how you would determine how long you'd want to work out each time. An easy way to look at it might be maybe you work yourself up to being active 5 days per week for 30 minutes. That would be a good way to break it down. But if you haven't been active, you don't want to jump right into that volume. We want to progress the body incrementally into that. So if you're currently inactive, probably about 10 to 15 minute bouts would be a good place to start. And then every 2 to 4 weeks, maybe you're increasing just a little bit more until maybe you can maintain that 30 to 60 minutes of activity comfortably. And again, it should be in the moderate intensity activity category. Type, that's for you to determine. Again, it should be something that's enjoyable, something with it being cardio focused, it should be something that's rhythmic, where you're using all the large muscle groups and your breathing rate and your heart rate are up. So that's, again, where you have a lot of flexibility. It could be, it could be going for a swim, it could be brisk walking, it could be riding a bike. Later on in the session, or the presentation tonight, I'll share a couple more ideas for if you're starting from the place of kind of limited mobility, some ways that you can get a little bit creative and get your heart rate up even from maybe a seated position. I'm going to progress into recommendations for a strength program. Like I said before, strength is not something that we do quite as often as cardio. And you definitely don't want to do it back-to-back days if you're working the same muscle groups. Sometimes people will get to the point where they are strength training every day, but they aren't. They'll usually alternate. Maybe it's upper body one day, lower body the next, then upper body, then lower body, so that the same muscle groups aren't getting worked back-to-back. That would be the goal with strength training. If we're looking at the FIT principle again, as far as intensity goes, it might be a good idea to start moderately, so choosing a weight that you can pick up and maintain good form for about 10 to 15 reps. And then over time, you can slowly increase that rep count as you get stronger. But say, for example, you are going to do squats. Your first time might involve doing 10 squats, and then 2 days later, you'd do that 10 squats again. And over the course of a couple weeks, you would increase to 15 and then maybe 20. And once you can do that exercise comfortably with safe form about 20 times, you can probably add a second set on of that. But at first, you want to start with just one set because you don't want to overstress the joints. And you want to make sure that your body has time to adapt. So that, because when we overstress the muscles, when they aren't strong enough to keep proper form, that's when we can become at more risk of developing injuries. And then as far as type goes, it could be a variety of different things. If you have a gym membership, maybe you can go and use machines. If you are just working out from home, maybe you have some dumbbells or some bands. Some people will even get creative and you'd use household items like a milk jug or some cans of beans or something like that. It doesn't have to be an official weight or band for it to work. So that's where I would encourage you to just consider what you have available to you. You can also just do body weight stuff too. We don't always need to be holding something to get to stress those muscle groups. So my biggest encouragement to you is, if you don't have a background in strength training, that you watch videos of trainers explaining proper form, or you hire a personal trainer, a physical therapist, or someone who can guide you through that activity, because it's extremely important that you aren't lifting with improper form, because it just really increases your risk for injury over time. Recently, I heard someone make a really good point about the fact that the human body is capable of moving in all kinds of directions. So it's not that just like, we do risk injury with that one time that we kind of lift inappropriately, but it's more so if you routinely are performing squats with improper position or improper form. It's the repetitive motion in a compromised position that will really increase our risk for injury. And so that's, again, why I encourage people to set that really solid foundation for themselves. We tend, like I said, from the beginning, we tend to focus in on cardiovascular and strength training, but flexibility is also extremely important and can really support our training as well. Strong muscles do often get kind of tight. And when there's tightness, especially imbalanced tightness from lack of flexibility, it can also compromise our joint health. So stretching is extremely important. However, one point I do want to make about stretching is traditionally we used to hold a static stretch, or like thinking about touching your toes and holding that position. That would be an example of a static stretch, something where the muscle is stretched and held for a long period of time. Traditionally, we used to warm up for sports and different forms of exercise that way by performing those stretches, but we found that it's actually when you stretch cold muscles, you can actually cause micro tears in the muscle cells, which then when you go to do that higher intensity activity, it predisposes you to injury. So it's actually better to do dynamic movements that actually put the joints through the same range of motion that they might be going through during the cardio activity. It's better to do like arm swings and leg swings and things like that to warm your body up. And then after you're done with activity, after you're done with exercise, that's when you would perform the static stretching, the held positions, because at that point the muscles are warm and there's a lot of blood flow to the muscles, so they're a lot more pliable, and then you're a lot less likely to cause those little micro tears in the muscle cells. But some examples of practices that help improve flexibility might be Tai Chi, yoga, Pilates is great with flexibility, but also building core strength. They also help improve balance and coordination and also help you relax. Each form of movement and exercise has a different way of helping you release stress and relax. But if you imagine yourself going out for a brisk walk or a run, even though that does release some tension, it also can hype you up a little bit too. And taking that time to stretch at the end would allow your body to just relax a little bit more. So again, there are a lot of benefits to flexibility and preventing muscle imbalances with that. So I encourage people to incorporate that a couple times per week too, especially after a strength training or cardiovascular session when their muscles are going to be a little bit more tight and warm.